Our second speaker is Juan Santucci. Juan is a 46-year-old man with a stage 2 colon cancer past who has completed his second anniversary. He is going to talk about his experiences.
Good morning, everybody.
Good morning.
I'm sorry I didn't give you a little bit more of a description to do introduction. And thank you very much, Tanya, for sharing with us your experience. I was diagnosed 2 years ago when I was 44 with colon cancer, and in my case, it was a total surprise. Cancer has never been part of my family or anywhere part of my life. So it came as a big surprise. I was very fortunate to be diagnosed at a relatively early stage. And I was very fortunate in a lot of ways, starting with my family, the friends, people that immediately rallied around me, but also living in a country that had the means and the technology to really help me out of that situation, and most of all, ending up in an institution like this one, NYU, where I ended up doing my treatment. I was diagnosed in Mount Sinai. I underwent surgery in Mount Sinai. I had sigmoid colon resectomy, and after that, we went on the search for an oncologist, and we ended up seeing a lot of oncologists until we decided to proceed with treatment with Dr. Howard Hochster, who has now moved on from NYU, but I've done the treatment with NYU here. And NYU is a very dear place in the hearts of the Santucci family. This is where our children were born, and it feels a lot like home. And it was something that helped me a lot as a patient to, in a way, be back to a familiar place. Let's see. All right, so going a little bit to what Tanya was saying before, and the first advice that she had to stay out of, not to go online. I will give you a little bit of my experience. First of all, like Dr. Aswell was saying before, not all cancers are the same. Not only that, not all patients are the same, and not all doctors are the same, and not all families are the same. So having to find the right combination is very difficult all along the process. Calling it going online, selecting what treatment one is going to do, where the treatment is going to be taking place. I think that the biggest hurdle that we have as humans to deal with cancer is finding a solution when we have so many different variables. And we speak about cancer, but everybody in this place knows that cancer is very different. I mean, there are very different kinds of cancers, and there are very different kinds of patients. So trying to find solutions is really such a huge challenge. And from the very beginning of diagnosis, the first thing that I remember feeling was the fear and anxiety of hearing these overwhelming situation coming over me. And then along the process, becoming a patient, doing the post-op, doing the treatment, and along the way, we go through stages of improvement, and then one day we're called survivors, and a lot of people look at cancer survivors almost as if we would be heroes. And I would like to say that from my perspective as a patient, the heroes are the doctors and the family members as well as the patients, just as much. Because in a way, we as patients just follow directions of what the doctor tells us to do, but we embrace the love of the people that surround us, and they are just as, everybody's a hero. This in a way, is a story where everybody is there is no bad guy in this movie other than the disease that we try to overcome. And so I just wanted to make a point on, like you were saying, the interaction with the doctor and how to find the right combination. And I can't say enough good things about my doctor, how he has taken my cause and made me feel like I was his most important patient. The same thing with the nurses, and that gave me a lot of comfort to be able to go through the whole process. I remember right after surgery having to decide on chemotherapy and then feeling the temptation to go online and read and learn and try to see what was the right decision. And I feel bad about the doctors because they have to deal with patients who we all think we know a lot about all these things just because we go online and we have so much information that the poor doctors have to be questioned all the time by patients who have read all this. And again, my congratulations to the doctors on that. Deciding on chemotherapy for me was a little bit difficult because of the way of my cancer was peculiar, that there was a big percentage of odds that chemotherapy might not be needed. And then I would hear all about this difficult situation that chemotherapy would bring to my body, so I tried to resist it until we came to a conclusion that I had to do it. But that, I'd like to underline the online aspect of it. I completed chemotherapy. I followed Dr. Hoxer's advice. We went through chemotherapy, and fortunately, ever since then, I don't have any evidence of the disease. Thank you. But most of all, I wanted to go back to about the fear and the anxiety that cancer brings. It can be overcome with the help of people that come. Everybody here, just showing up here means that we all want to do something to overcome that. I want to thank the Faces of Cancer for giving me the option to come here and share my story with you. I remember during the path of my disease, I always wanted to find other patients, because it is a very peculiar thing when one is a cancer patient. It is something that is very difficult to understand unless you are talking to another patient. Doctors have a lot of experience in dealing with patients, but they have never been a patient, and that makes us come together today and meeting other patients and know that we have some kind of bond, that we all know what it is to be diagnosed, to be having to go through the process of selecting the best treatment and then follow through that. So I think that I have said pretty much everything I wanted to say, but I would be happy to answer any questions that you might have.
How did you discover the diagnosis?
A good question. I discovered my cancer because I started noticing very, very, very small drops of blood when I went to the bathroom. And I have a very good doctor, obviously, my internist doctor, not my oncologist, who I mentioned this to her, and she said, "You don't fit any of the typical profile of anything being serious, but you're approaching the age where these things should have to be done," and she had me do a colonoscopy. And colonoscopy, I don't know if in this room we have other colon cancer patients, but colonoscopy is such a magnificent discovery, and it's such an easy way of avoiding what can happen. So I am a big supporter of that, and I would urge everybody to please get a colonoscopy. It's not fun, but it's compared to what can happen later, it's much better. So, anything you would like me to add? Well, yes, just to finish off, I don't want to bore you, but surviving cancer and the use of the term survivor is something that I personally don't know if I agree with the word survivor, because maybe one survives when the disease is way behind, and then I would consider myself a survivor, but having been a couple of years after my diagnosis, and like Tanya was saying, it's still very clear in her, if I understand correctly, it's been 1 year, half a year, sorry. I have been 2 years, and when I look back, it kind of like looks like a dream that happened many, many years ago. But it is important, like you were saying, to remember what it was, the moment of diagnosis, and what it is to go through the whole process. It is a long process. It can be a little repetitive. If the medicine, you have to get in this regimen and take it all the time. But it is important, I think, to remember and what it is all about. And in my case, taking away, and my wife has heard me say this before, taking away the anxiety of going through such a difficult problem as cancer, everything else other than that it brought to my life has been extremely positive. I have this. It has changed. It has changed everything. Cancer comes and brings a lot of stuff to life. It brings anxiety and fear, but other than that, in my case, it brought a lot of refocusing what is important in life, spending quality time with people that I really care, and people who care a lot about me, that I was not, I was aware, but I wasn't so, let's say, I wasn't on the day-to-day thinking about it. And now I do. It's not that I want people to have cancer, but I do want to underline the fact that great things can come out of this. Great things can come out of this road or this path that we have to walk. And it has, in a way, enhanced my life a lot. And in that, I would be happy to use the word survivor. And then the other thing is that the awareness of how common this problem is. My mother-in-law, who's here today, she has a husband and 3 children, and in the last 10 years, we've put her through 3 cancer cases in the family. So it's not a big family, and yet it's incredible how present this thing is, and I wish we all keep it aware. And I've also learned this morning, looking at an email that I received, that tomorrow is National Cancer Survivor Day. So I wish everybody here, because everybody in this room is a survivor, haven't had cancer or not, but happy Cancer Survivor Day. Thank you very much.